Hello and welcome to this special edition dedicated to the topic of COVID-19. I want to inform you about our community responses to this pandemic. My name is Carol Merton. First of all, though, I need to express and wish to express a sincere thank you to our Medical Officer of Health, our health unit staff, our community service providers and our support agencies, our first responders, our doctors, nurses, allied health professionals, the hospitals, retirement homes, long-term care facilities, our essential frontline staff that provide the services to us in grocery stores, pharmacies, and so many others that I have not mentioned. These individuals, by their prompt action and ongoing efforts, are helping to keep our community safe, and for that we are very grateful. We are all together in this exceptional and ever-changing situation, and we are all neighbors doing our best to care for and to support each other. Here at Rogers TV, we will be providing you with current information from our community agencies and our elected officials. However, as you're probably aware, this information changes rapidly. To stay current with the situation, we encourage you to go online to the Public Health Unit website at publichealthgraybruce.on.ca, listen to the radio, and of course, tune in to Rogers TV for updated information. Today, I am delighted to welcome as a guest Gary Sims, who is the President and CEO of Grey Bruce Health Services. Gary, thank you for joining us today. I know you've got lots of information to share about the hospitals and what's happening around COVID-19. So can you tell us a little bit about yourself first, and then I'm going to ask you just to take it away. The program is all yours.
Well, thank you, Carol, for inviting me to be on your show. I appreciate that. A little bit about myself. I've been in healthcare for over 4 decades. Started at a young age as a pot washer at Northwestern General Hospital.
Wow.
I've worked in many different departments throughout my life. I've worked as a registered nurse for several years, and of course, I've been a CEO for the last 12 years. So
Excellent.
A long journey to get here, but one filled with great experiences and great memories.
I didn't know that about you. So you certainly know the inner workings of the hospital sector and have seen it from a variety of perspectives.
Absolutely.
But the perspective we're all learning about is the perspective related to COVID-19 and this pandemic, and for us, it's new. So tell me a little bit about how Grey Bruce Health Services is changing, what your planning is, and what services you're currently able to provide to the community.
Well, these are certainly unprecedented times, having gone through SARS on the front line myself, and then with Ebola, H1N1, MARS, etc. We've learned so much, but here we are in a situation that we've never seen before, worldwide pandemic. Grey Bruce Health Services has certainly risen to the occasion. I'm proud to say that we've been working for at least the last 2 months, reviewing and updating our pandemic planning, of course, then developing all of the specific strategies to cope with hopefully something that we never see, but reality will be, we will probably see it. So having said that, we are working with, of course, our provincial partners, our regional partners, and certainly within our organizations, we have 6 sites. All 6 sites, the staff at each location have worked diligently and committedly over the last 6 weeks to put in place those things we feel are needed locally. So with that in mind, the things that we have done, of course, unfortunately, we've had to decrease our non-essential services in order to open up capacity to manage and cope with what we expect will be a push made by all of the patients that are created through COVID. You know, probably by now, we still offer all of our essential services. So, of course, critical surgeries, emergencies, obstetrics, you know, we're still delivering babies. We still have people who unfortunately are having heart attacks and strokes. And so we're still doing all of those core services. Unfortunately, some of the day surgeries have been removed. As some of the cancer surgeries have also been removed. However, we are now looking at bringing those back, at least for the most urgent cases. With the COVID preparation in place, most of our sites now have created separate areas in their emerges for respiratory conditions to be managed, so as to ensure that we are putting the right people in the right place, and that the patients that need the respiratory support are getting it in a specific area. We have, in the last 2 weeks, had an assessment center in place to assess COVID patients and patients from the community. And the purpose of that, of course, is to decant away from our emerge to allow it to function properly and not be flooded. Happy to say that that strategy has certainly created a redirection of patients. And initially, though we saw large volumes, those volumes have dissipated. And we believe that we've managed to hopefully settle some of the fears that are in the community, because everyone faces those fears now. There are a lot of unknowns. Internally, of course, we have prepared for the worst. So in that, we have a multi-phase plan in place. At each of the sites, we have started to move some of our long-term care patients to one of our rural sites in Markdale. We are this week moving medical patients to our Meaford site. And the purpose of that is to create a greater capacity within the Owen Sound site, recognizing that many of the patients affected by COVID-19 need to be in a critical center where there is ventilation and ICUs. The Owen Sound site and the regional site leads have been working together, training staff, preparing them, creating the circumstances where all staff across the whole organization can manage COVID patients, both in urgent and emergent circumstances. At the Owen Sound site, the staff have been preparing to manage and expand our ICU so that we can take more ventilated patients should we require it. They have created a very large respiratory emerge that can handle up to 150 patients a day. We stand right now at a capacity of less than 60%, which means 40% of our beds are empty and ready. Our staff are standing ready. They have been training for the last 3 weeks, and our physicians and lead staff have been working together to create some of the necessary pieces to allow us to function, care paths, methods of caring for patients at different levels. And we've been working with some of the top infection control experts across the province to ensure that what we have in place will be adequate and the correct amount of care for the Owen Sound Grey Bruce region.
So if I could just ask a question. So you've been redirecting patients to different places to free up the hospital beds. How has that, I mean, those are tough decisions to make. So who makes those decisions? And how are you finding families or the community, how are they around those decisions?
They're great questions, Carol. You know, many of the decisions that we've had to make during this crisis are difficult, they're personal, and they affect both the patient and the family, and quite frankly, the community. We do it as a team. No one person makes the decision. We are certainly directed and advised by the ministry and by our regional leads as to when it's important for us to set certain stages in place. The movement of the long-term care and the medical patients was directed by our regional leads in planning as a region to be ready. We don't make any of the decisions lightly, and we plan heavily around it, understanding that that impact is very personal. But I think the feedback I've received to date from staff and the community is positive. I think people understand the level of fear that is in the community and the level of need to respond to this unprecedented times. So when we make decisions, we do it with that in mind, for what's best for all. And sadly, for some, that means there are personal sacrifices, which I think the community is feeling now as they hopefully are social distancing and they're doing the things that are being asked of them by public health.
So currently, as we're talking today, you have 40% capacity within your Owen Sound site.
Actually, across the whole organization. Okay. Now, having said that, I can't say that for Parkdale and Meaford because we have just transferred patients. But all other sites, that's absolutely the case.
Right. So my understanding is, we're starting to climb, the curve, and we're anticipating, unfortunately, that there may be an increase in cases over the next little while. Will you have enough capacity? Do you anticipate? And what will happen if you become filled 100%?
Great questions. The calculation for what the volumes will be is quite complicated. And certainly the public health have done those calculations, as have the Ministry of Health. Based on those calculations, we believe we will be able to absorb the numbers that should be in place. That being said, we can't count on that for sure. If there ends up being a hotspot, we certainly could be overwhelmed. And I think that's the part of the preparation where regionally, we're preparing that if there is a hotspot, that we're all capable of helping out in that hotspot so we can move manpower and resources to support it. We're fortunate in the Grey Bruce area that we've done a lot of close planning with our city and with public health. We are looking, as I'm sure you're aware, at building, and we are building right now, a field hospital as a fallback. So even though we believe we probably have the volume internally between ourselves, South Bruce, Grey, and Hanover to manage the volume that could come, we are building a field hospital in Owen Sound for that sole purpose. If we are overwhelmed, we have a place to decant and take care of those patients.
So I wanted to ask you a few more questions regarding your capacity. And we've talked about beds and what your plan would be if you reached 100+% occupancy. So can you talk a little bit about your human resources? I mean, how you're coping and whether there's a need for more. So let's talk about that first, and I'll ask about other things afterwards.
Sure. Whenever we're doing planning, regardless of any kind of plan, we consider all of the factors, logistics, safety, human resources, patient conditions, quite frankly, even finance. We consider all of those pieces when we're making the decisions. Human resources, we can do nothing without it. It's the number one resource that's our business. 85% of what we do is driven around the capacity or human capacity within the organization. Today, because we have decreased the volume of beds and patients, we're happy to say we believe we have enough staff standing. We are now looking at enacting how we can rotate staff, protect staff from being exposed, training them on keeping them safe. We have logistically looked at several different scenarios on what ifs and how we might move staff around depending on the urgency and the pressure that we feel. So we enact those phases as we see fit and as we start to see what we're going to face. I would say that there have been many teams working very long hours, committed and diligently working to develop those plans. I can also tell you that Grey Bruce should be very proud of the workers within our hospital. They sit prepared to face something that we've really never seen before. They've worked hard to prepare themselves. They do it bravely. They're committed to their community and they're committed to their organization. So, you know, I'm a new leader to Grey Bruce, but I can say very proudly that the staff that are here are committed and they're ready to go. So from a human resource perspective, I think there's been a great deal of work that's put us in a good spot. But I still sit with my fingers crossed and hope that I don't have to bring any of those steps into place.
So if it turns out that additional hands are required, people could go onto your website and just look to see if there's any postings available for assistance of some sort. So we would encourage people to stay current with what Grey Bruce Health Services might be requiring. When you discuss staff, just as we're learning in the community about how important and essential our grocery stores are, our cashiers are, the people who deliver goods in a hospital, frontline staff are also the people who provide those daily services, from housekeeping to the people who provide food. I mean, it's all the staff together are really essential services in a hospital setting, correct?
Yeah, so people always think of a hospital as a nurse and a doctor and a patient. Hospitals do not exist without support services. As a guy who has worked housekeeping, maintenance,
Yes.
In the kitchen, and as a frontline worker, I can tell you they work hand in hand. They are the left hand and the right hand.
Yes.
During pandemics and epidemics, we could not survive without great housekeepers, without the kitchen providing food, without the people who sterilize our equipment, and the laundry in these times when PPE is so challenged, to have our laundry folks committed and producing those most essential protective pieces for us. I can tell you that there are social workers, mental health workers who are helping their colleagues and providing support and counseling. There are so many people in this network. It's extremely complicated, I know, for people to understand, but there are maintenance guys making sure that the heat is right, the air is there, the water's there. All the things that you fundamentally count on day to day become more paramount in these difficult times.
Yeah. In other words, they're a community within a community providing community service. I mean, it's just everyone together. I'm wondering if you could talk a little bit. I mean, we've been hearing in the news about protective equipment and also respirators. Can you tell us how we're situated here in Grey Bruce?
Well, I can tell you across the province, across the nation, and probably across the world, you can tell that what we call PPE, the protective equipment, is at a great shortage. We're very fortunate in Grey Bruce. We've had a lot of support from Bruce Power and local citizens who have been so kind as to drop off as much PPE as they can spare for us, and that has been really helpful. We feel confident that we have enough to cope right now, and we've been really lucky in that we've been able to, quite frankly, start to make some of our own. We have been able to, we kept stock of SARS gowns, which are washable, and that has helped greatly. We've had 2 decades of moving to single-use devices and to having nations or singular nations create the PPE equipment, and it's put us in a bit of a vulnerable spot. One of the lessons learned, I think, from this will be that we need to be a bit more self-reliant. And I think here in Grey Bruce, the lessons we have learned is we are all in this together. And you just said it beautifully that, without the community, without the support people, we have people in our community right now sewing gowns for our frontline staff. We have staff in the house making masks. We have local companies making masks, making shields for us. We have, a dedicated business community that's kicking in to provide us with the equipment. So if it were not for that, we would be in a difficult spot. But where we are now, we have adequate. Would I like more? Absolutely. And if there's anybody out there that has half shield N95 ventilator respirators for my frontline staff, I would happily take them.
And that's a beautiful lead into what I was going to ask you. How can the community help? So your first plea is, please look and see if you have any personal protective equipment, and who would they contact them? Are you going to give them your cell phone?
I'll tell you what, I'll give them. They can go to our website, and if they go to gbhs.on.ca, they can see there are some requests for equipment and how to drop them off and where to bring them, along with a list of job applications. I will tell you, job postings. We have received, we posted, I think, just a week ago, and over 100 people came forward.
Wow.
So, we're still looking for frontline workers, nurses, and we're trying to build that portfolio, again, just in case, but also because we're serious about making sure that we're ready. What can people do for us? I think most of all, keep supporting each other, keep social distance. We don't curve or succeed in any of this unless each of us takes our own accountability and responsibility for our behaviors. Social distancing and making sure that you're safe creates a circumstance where we as healthcare workers are not overloaded. And the reality is here, we cannot stop this virus. We can slow it down. If we slow it down enough, our healthcare system will be able to respond and support our citizens to get through this. And hopefully, if we stretch it long enough, we'll develop techniques for managing and caring for people, improving outcomes, and hopefully we'll get to a point where we have vaccines in place. So those are the key ways that I can see that people can help us.
Now, I know earlier in the conversation you had mentioned that we always have to consider finances. So you haven't asked for donations other than personal protective equipment, but would donations be helpful for you at this point in time? Because I can't even imagine the costing when all is said and done that was not budgeted for. How can you budget for something like this? So is that something that would be helpful for you and your organization, for the community to consider? If I didn't have a PPE, what could I do? I want to support my hospital because ultimately I'm going to count on you to take care of me. Not good, I don't need you, nothing personal, but so can you speak a little bit more?
Great question, Carol. Our foundation, we're not guaranteed our funding, quite frankly, for this circumstance, and we do not put money aside for this, and we're not allowed to under our funding structures. Having said that, our foundation does have a COVID Fund Foundation, and if you go to our website, there's a link there that you can connect to, and absolutely we would be very pleased to receive funding to support us. I can tell you, a bit of a shocking number that was given to us this morning. We've been doing this now for around 6 weeks, and to date, though quite frankly the vast majority of the spending has been done purposefully to get us ready. We will have spent probably over $2 million by the time we're done. Yeah, it's not a cheap thing to do this. It's very expensive. But, you know, I talked to my board just the other day about the need to be ready and the need to spend where we need to thoughtfully, but we cannot be not prepared. We have to be prepared. So my board's instructions were direct. Just do the right thing. And so that's what we're doing.
Yeah. So I'm wondering how you're coping. I mean, I can't even imagine the hours that you're putting in and the stress that you're under. And of course, all of the leadership team as well as the staff. But for you, how are you managing?
That's a great question. I think I've seen my family 3 times now in the last 2 months. Wow. So yeah, you don't get a lot of time, unfortunately. But I'm supported by a fabulous team. I'm engaged by physician leadership that works 24/7, by frontline staff who are ready. You know, I don't know what can motivate you more as a leader than to be surrounded by excellent people committed to their community. And the team of executives here, the management team, all the staff, you know, that's what keeps a leader going. That's what drives you to do the right things. And it does take drive. I promise you, I probably live, breathe, and eat this 7 days a week. And my staff have gone as long hours as I have, and if not longer, some of them. And, you know, when I see that, we're all a team. So everyone keeps going because we're only as strong as each other. And so we keep going. And, you know, what we hope for is normalcy somewhere along the line. And you know what? We'll take a breath when this is over.
Yes. I can't believe our time together has finished. It's been absolutely fascinating talking to you, and I'd like to extend an invitation to you to come back and to share how Grey Bruce Health Services is managing, and once we get to the other side, how you're coping as well. Thank you very, very much, Gary. And thank you to our viewing audience for tuning in to Rogers TV Special Edition COVID-19. Please stay safe. Take care and stay connected.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media. This is Rogers TV.
Hi, I'm Carol Merton. I'm the host of HealthLink. HealthLink connects home, community, and healthcare. Please join me for HealthLink on Rogers TV.